Welcome to a special edition of the Pharmacist Matters podcast. I'm your host, Justin Bates. On today's program, we're going to talk about some best practices and hot tips on how to optimally implement the COVID vaccine into your practice. We have two pharmacists who were intimately involved in the planning process, early days, and implementing the COVID vaccine in their practice in phase one of the initial rollout. Joining me today is our chair of the board of the Ontario Pharmacists Association, Jen Baker. In addition to Jen, we have the vice chair of the board, Tim Brady. Jen, I'm going to start with you to provide some insights and elaborate on just how this has gone from the early days 2 weeks ago to where you stand now, 2 weeks later, having gone through all of the workflow considerations and operational details. And maybe this will help some of our members who are looking at whether or not they should participate moving forward, and those that are going through the onboarding process as we speak for phase two.
Thanks, Justin. I'd say probably my most valuable lesson out of the process of launching this program in my pharmacy was to take the first day of going live as a test workflow day. And so what I mean by that is for my first day, I booked patients in, but didn't open up my calendar beyond that. So I didn't book any patients beyond my first day of going live so that I could actually test the amount of time it took me to have a patient come through my pharmacy, how many people on average, would show up early or late, how to accommodate for the space in the pharmacy and the way in which patients would typically flow. And with that, I gained a lot of really valuable information, such as on my first day, I was overambitious and I actually overbooked myself. So in learning that let me adjust for my subsequent appointments. And that means I didn't have 500 patients booked at a time that I couldn't sustain and have to go back and fix my calendar. So I would really suggest for anyone just starting out, when you're initially booking, don't book past a certain time and book for days where you're going to have different staffing models, because it will look and feel different depending on the footprint of your store, how many staff you have working, and in what roles. So really test it out before you commit long-term to a calendar schedule with patient appointments that you might not be able to sustain or might be very stressful for your staff. I think that was probably the biggest thing that I took out of it, and the thing that Jen now is most grateful for past Jen too, because it definitely helped things out to be able to go back and pivot and make those adjustments. I think probably the second thing that I learned was that I needed a better solution for my phone system in my pharmacy. We're a small pharmacy. I am the owner-operator, and I have one pharmacy assistant with me most days. I was fortunate enough to have some pharmacy technician help, someone who's an injecting technician. So my workflow looked a little bit different on those days. But for the most part, we've been operating in a 2-employee situation with 2 phone lines that rang constantly. There were many days where we couldn't get a line out to call back patients or to even pick up the messages off my voicemail. So one of the things that I'm still currently looking into, and I think once things sort of die down a little bit as we reach the tail end of our 500 and some odd doses, is that I need some form of auto attendant or IVR service on my phone lines to minimize the number of times the phone is actually ringing through. I did find that the ability of my own patients for my prescription business, as well as the symptomatic COVID testing program and other pharmacy programs that we run in the store, that those patients weren't able to easily get a hold of us. And I was initially quite concerned that we may lose patients or have patients making complaints about the fact that we were very hard to get a hold of in those initial days. So if you are going to be onboarding into the program, if you can have something that sets you up for success with your phone communication well in advance of the program, that'll put you in the best possible scenario to serve both your patients for the COVID-19 vaccination program, as well as your regular pharmacy business, which still needs to progress while you're immunizing people. I've found that most people are relatively understanding with what's going on, and because they know that we're helping the community. However, it was very overwhelming for my staff and I, and we did have to bring in additional people on additional lines just in order to get back to everybody. I think the third thing would just be the importance of an online booking system. Without our online booking system, we would have been adrift in the middle of a sea and not really been able to manage the administrative work associated with the program. Initially, I thought this would be somewhat similar to our flu program, and boy, was I wrong. The actual implementation of this program looks significantly different than flu. The administrative burden is a fair bit higher, and really the patient interaction and patient contact that goes along with the immunization is a lot more substantive than that with the flu program, because patients have a lot of questions. And being able to spend some time with them, put their minds at ease, explain what to expect and what they should know in terms of the vaccine efficacy, down the road, what second doses are going to look like, what to expect, why there is that extended interval in between doses. Patients really appreciate that time with the pharmacist. So you need to account for that within the timing of your program. And the flu program really doesn't have that high intensive amount of conversation that needs to happen before that immunization. So it looks substantially different than flu when you actually are implementing it in your pharmacy. So from that standpoint, when I was thinking that I could do a certain number of injections per hour, when I was basing it off of my flu experience, I was, quite surprised actually at the additional amount of time that it took and the amount of time that we're keeping patients in store for. So between the check-in and the administration, the counseling, the documentation, providing the records, having the patient wait their 15-minute waiting period, you do expect that patient to be present in your pharmacy for a little bit longer as well too. So that online booking system was really instrumental in keeping us moving smoothly. The number of patients I've had that just say that the system worked very well. They were well reminded. They appreciate being able to fill out forms online in advance. So absolutely, if you don't currently have a way of booking patients in where they can do some form of self-service, whether it's booking in themselves online, adding themselves to a wait list, or being able to schedule their own appointment after they've been notified that they've been matched to a dose, I would highly suggest purchasing a subscription to one of those programs, because it is well worth its weight in gold when it comes to this program.
Jen, you hit about all of them. The only difference is, I can tell you, biggest learning, one of my stores I was holding off for the booking program. The other store I made the mistake of taking people's names. Do not do this. I was sitting at day one with 14 pages and 500 names on it. And it took us probably about 20 extra man hours just to call these people on the phones. So do not just tell everybody, if you're getting a booking system, just get a booking system, and just keep telling them, go online and do it that way. So it'll save you oodles and oodles of time. And number two, phone calls. On the good news, were inundated. I think day one, we had about 150 calls in 90 minutes. I have 3 lines, so they were running endlessly. But on the good news, we're always saying in pharmacy, we want to interact with our patients. This has given us an opportunity to interact with patients like never before, and they are so appreciative. So if you can keep your staff sane and not lose all their hair like myself, you can try to do it. It is frustrating, but it is rewarding.
How are you managing the integration of the COVAX system with the billing of H&S for the claims and just the whole process and the workflow and operationally? Walk us through how that works for you.
It takes a little bit. Like Jen, I the first day I did a trial day, about 5 or 10 patients. That was it. I found we got an iPad. We keep the COVAX on that, and then we actually do a regular computer system. So we have a 2-person system. One person just checks them in and COVAX on. The pharmacists themselves is only handling the administration part on COVAX on, and at the same time under there, they can bill it actually on the actual computer system. We use Scroll at the time, or you can always do it later. And then they basically go to wait, and then that first staff member that checked in is actually the one that issues and prints out the release. So basically, we have them sit down. They're not going to leave until they get that piece of paper. That's what they want. So we make sure that we give it to them at the end of their 15 minutes. And then my other store actually doesn't bill right away. What they do is they just print 2 receipts. So they're able to hand one to the person. We keep an extra one back, and then it just allows us at the end of the day or during the day to make sure we can bill through our normal system.
What I've been doing is the day before, I use the drop-off functionality in Kroll to drop off all of my injections for the following day based off of my appointment list. So I run through and I find the drop-off functionality in Kroll the quickest way to add everyone's immunizations through in one work order. The benefit of the work order is it tells me how many patients I have within that work order. So when I go to verify and start billing the following day, I can compare the number of patients I actually immunized off my appointment list to the number of prescriptions in the work order. And that tells me that I've captured each one of those patients for billing. And if the numbers are different, I can go through alphabetically and look to see who I've missed dropping off so I can ensure I bill for that patient. When the patient comes in, I have my assistant check them in through Covaxon, and from there we verify that they've completed their online documentation and consent forms within our online booking system. If they haven't, we have them fill those out in paper on the spot, but we do encourage people to fill out their forms in advance to try and make this as contactless as possible. Once we verify that, we check their health card to confirm their identity and have them go to a seat within our vaccinating area. We set out chairs spaced out by about 8 feet along our perimeter of the pharmacy to prevent any sort of cross traffic with our OTC aisles. So that chair is the patient's home for the entire time that they're in the pharmacy. Once they're in their chair, I, as the pharmacist, go over to them and counsel them on expected side effects, efficacy of the vaccine, and give them the opportunity to ask questions. While I'm doing that, my assistant, who has already checked them in through Covaxon, is rebooking them for their second appointment through our online booking system. What we've been doing is just automatically booking for 16 weeks from the date and time of their appointment. So if they're here with me on, a Friday, the whatever date of March at 10:15 a.m., they're going to be booked 112 days from that day at 10:15 a.m. again. So it makes it relatively easy. I know my days in July, 16 weeks from now, will look very similar to my days now. So I know what to plan for in terms of staffing. I do let the patient know if July comes and they need to rebook, we can look at doing that. But we're doing this to ensure that they have an appointment confirmed, so they know when and where they should be coming back to ensure that they actually get that second shot. So typically, as I'm going to grab their immunization, they're getting a ding on their cell phone and they get all excited when I come back because they're like, look, I already have my second appointment time. So that's already points for us. We've met their expectation that way and it works quite well. I give them the immunization. I let them know, to call me over if they're feeling at all unwell at any point in time. And then I go and document the vaccination in COVAX. As I'm doing that, I generate the receipt immediately and print it off, and I staple it to an aftercare sheet that also has their second appointment date and time written on it. I've been using the opportunity to promote myself. I've been stapling on one of our flyers that talks about transferring their prescriptions to our pharmacy, and I've been adding on a mini hand sanitizer as a replacement for their lollipop because I get to tell the joke that it's more healthy than the lollipop unless they actually try to lick it. That usually gets 1 or 2 laughs a day, but not as many as I'd hope. I'm not nearly as funny as I think I am. But, with that, I bring that paperwork over to them when they're approaching their 15-minute window, let them know that they're free to go and that we're looking forward to seeing them in 4 months. That whole process, at that point in time, I'll also be emailing them the receipt from COVAX. So they have both a paper copy of it, which is typically what people use for their social media posts. I have a paperless scroll system, so I've been printing that on my thermal printer. It works quite nicely, and it has my pharmacy header on the top, so they remember where they received the first immunization. Plus, PharmaSave, Loyalist Pharmacy is now all over social media with people taking their selfies with their dose receipt. So they have that copy electronically. They typically get that emailed to them while they're sitting in the pharmacy as well, too. So people typically leave quite thrilled that they've already gotten their electronic communication about their second appointment and their dose receipt. And we've actually experienced a fair number of transfers in because of the organization and service. So, it's worked very well for us. We're a small pharmacy and, our volume is sort of consistent with what we're able to do throughout the day. But I would suggest really thinking thoughtfully about it because this is a real opportunity to enhance your regular pharmacy business by all these new individuals who come into your pharmacy just for this specific service.
That's great. That's fabulous insight. I think it would be really helpful for those stores that are coming on board in phase 2 and 3. Tim, maybe you can speak a little bit about the experience with Kovacs, getting onboarded with it, and also just managing that demand. A lot of our members are asking us about what that optimal amount of patients per day is and what you can do and what the time intervals are between patients. What's your experience thus far?
The first stop with Covaxon is the original form you'll receive. You have to put lots of information, so make sure you put everybody's email. And prior to sending it out, tell every single one of your staff they're going to be receiving an email that'll say Salesforce password reset. So half of my staff just decided, oh, it's junk mail, and got rid of it, which caused issues. So just beforehand, let them know it's coming. There's only a 24-hour window for them to say okay to it. It'll make your life a lot easier. We've been chasing our tails since then. So in Covaxon, really, the training is pretty easy. It probably took me 4 or 5 minutes to figure it out. It's a straightforward database, but it's really not that difficult. I know the first patient I had, I made a mistake. You get to the first questionnaire and it asks all these questions. Do you have this? Do you have that? And I thought I'll be so smart, and I checked everything off, and it wasn't realizing to the second patient that I basically said they had all these issues. So go through that. That's the first day. But it's pretty forward. We're a busy store. We can do 200 scripts a day. We're also doing INR testings. We're also doing COVAX screenings. So we've got lots of things going on. And I found, we do 10-minute appointments, and that's with 2 people. And honestly, at 10-minute appointments, you don't need more than 3 chairs, because as the first person goes through, you're doing the second person sits down on the chair. By the time you're done the third person, the first person's gone, you've already wiped it down and disinfected the area to have them sit. So it's really not adding, like for a store like myself, we've got a small waiting room. So you can go at that pace. You're not adding more than 3 people to your total amount to your store. And at the same point, it's extremely smooth. Like, it's been great. People have said the same thing. We've got so many great reviews on the check-in process. Was great. They like using the computer system, and it was a really great experience.
What kind of questions are you getting with AstraZeneca in particular? Have you found any vaccine hesitancy or concerns around the vaccine itself?
Myself, no. To be honest with you, ended up with 500 shots and haven't had a single patient. There's been questions, lots of them, but it goes to show you the value they have in their pharmacists. They're legitimate questions. They've seen something on the news. You basically, give them the facts. And I always tell them at the end of the day, if you want to change your mind, you're fine. And I haven't had a single patient change their mind or say no. Once you get them the information, that makes sense, and then they move forward.
I've experienced the same thing, though we probably have a little bit of sample bias here, that we have people who are very eager in our self-selected population to come in. As we make it a greater way through our demographic, we may see a little bit more of that hesitancy. But for the most part, people come in with their questions prepared. They ask them, and they've been trusting our answers. And I agree with Tim. It's just testament to people's trust in the pharmacist as a medication expert. And I do think that as more data comes out, and AstraZeneca does look quite good. People are more and more comfortable with it. We're getting questions, about things like, should I do anything about this perceived blood clot issue, or is it actually a non-issue? What do you think? And so it's that opportunity for education as to to what to look for, but perhaps not an indication for things like baby aspirin after the injection. So we're getting lots of really good questions. People are being thoughtful, but I would say, just from the amount of inquiry coming in, I don't think that there's any real issue in terms of patient demand, or looking elsewhere other than AstraZeneca for their immunization, because people are understanding that the value of immunity right now going into that third wave, now is the time to begin to building those antibodies, because they need that immunity now rather than waiting for what may potentially be AstraZeneca down the line at a mass immunization clinic, or may only have incremental benefit against mild symptomatic illness, whereas we have that really, really fantastic protection with all the vaccines against the severe forms of COVID-19. So it's been a lot of education, and I think expect to have some longer conversations with patients before you actually provide the immunization. But a lot of demand, and people are thrilled to be coming in for AstraZeneca.
It's an emotional time, emotional for you as a healthcare provider, emotional for those patients that are coming in, and the gratitude. And I've heard lots of stories about tears, and just, this is what people have been waiting for so long. I imagine seeing the first box come into your stores was quite a moment. Now, what would you say as a final thought to each of you for those stores that are about to embark on this? What's your final piece of advice? And perhaps even for those that are on the fence about whether or not they should participate in the program?
Take a deep breath, breathe, plan. Don't overcommit yourself before you know what you can do. But ultimately, this is a fantastic opportunity to provide a public health service. Don't expect this to be a profit center by any stretch of the imagination, but because it is very work intensive. But I would say just, have lots of conversations with your staff about what to expect, accept feedback, pivot as you go if you need to in order to optimize the process, because this likely will change over time, as patient populations shift or as demand, shifts with different demographics being welcomed into mass immunization clinics. But you really need to pull together as a team. So if there's anything you can do to just make every member of your team feel valued and motivated to do this, now's the time to do it, because it's going to be exhausting. It's going to be demanding. There are going to be longer hours than you're used to putting in. So just, buckle up for the long haul, but find ways to motivate each other through this.
I agree. You got to get your team ready. So you got to do like a huddle pre-game. Let's go. But more than else, this is the reason we all went to school. This is the reason we all went to healthcare. I've been in the practice now for 20 years, and I don't remember a moment that was so emotional and so in your face effective. You are literally, every time you give someone a shot, the sigh of relief where they look at you and you just saved their life. Every day, and I do that 40 times a day now for the last 2 weeks. I have not had a time, even as stressful and as tiring it is, a more rewarding time of being a pharmacist, and the more times where people have said, I really appreciate what you guys do. So embrace the good moments. It is worth it tenfold. It's every reason why we went to school. It's all the therapeutics we studied. It's everything that we've ever wanted to do all rolled into one. So take an advantage. We're having an opportunity to cataclysmically change how people see pharmacists, or really start embracing that fact of how much of an important factor we are for the healthcare system in this province. So enjoy it, and it's going to be a heck of a ride.
I want to thank both of you for sharing your insights, and I really think this captures some of the lessons learned for those that are about to embark on this journey of providing COVID vaccines. We're about to expand to another 365 pharmacies in phase 2, and another 800 pharmacies in phase 3 throughout April. My takeaways are the top 3 learnings from what you shared, Jen and Tim. First is do a dry run. Don't overbook yourself in the first couple of days, because depending on your format of your store, your staffing levels, the staffing roles will change. And you really need to understand what the optimal workflow is before you have a lot of bookings coming in day 1 and 2. It's important to book at the right times to make sure you have staff overlap and that you are properly resourced so that you don't interrupt your day-to-day operations. Second learning, which I think is really critical, which is the phone lines are going to be jammed, especially in the first few days when there's this excitement when new pharmacies come on and people go to the government website, and often they'll go to your website and call. So overloading the phones really means having an IVR or auto attendant will help. And then lastly, the booking side, since pharmacies are responsible for their own booking systems, to alleviate some of the demand and volume of calls coming into the pharmacy and to schedule this out appropriately, use an online booking tool. It just so happens that OPA has a partnership with Medisys, who does a lot of this, but certainly whether it's Medisys or another solution, it's a very critical aspect of a successful campaign. So once again, thank you for sharing all of these hot tips and best practices. We hope this has provided our members and those about to onboard to phase 2 of our COVID vaccine rollout some helpful areas to address and to have a successful implementation. This has been a special episode of the Pharmacists Matters podcast. Look forward to the next podcast on mental health. And don't forget to subscribe on your favorite podcast platform.